Hello.
Hi.
How are you today?
Good.
Sorry my hands are cold. I just washed them.
It's okay.
My name's Angela Baker. I'll be doing your assessment today. Can you tell me what brings you to the clinic?
Just a physical exam.
Just a physical. Okay, we can handle that. Well, to begin, I'm going to ask you a few questions. Some of them may seem silly, but first one is, tell me your full name.
Abigail Elaine Baker,
Okay, and can you tell me your date of birth?
July 15th, 2000,
All right, and what month is it?
September
Do you know the year?
2018,
And who is our current president?
Donald Trump.
Great, and tell me, where are we right now?
An exam room.
Okay. So these silly questions let me know that you're alert and you're oriented. You understood my questions. You know where you are, you know who you are, and you know roughly what time of the year is. Okay? Now, to do your physical exam, I'm going to do it from head to toe. Okay? Ideally, I would like to stand on the right side of the patient, but our setup here doesn't really allow for that. So we're going to make do on the left side. Okay? So first thing I'm going to look at is your face and your head. I'm going to start at the head and go to the bottom. Your face looks symmetrical. No signs of really any scars or congenital defects or abnormalities. The skin looks pink and dry to the touch, warm to the touch. I'm going to now feel of your head and look at your scalp in some places. Have you had any problems with pain or headaches?
No.
Okay. So I'm just feeling for any lumps or bumps or anything that's not supposed to be here. Okay. Head feels normal. I would say she is normal cephalic. All right. Next, I'm just going to move down to your eyes. Look at your eyes as you're blinking a little bit. Your eyebrows are fine. Your eyelids and your lashes look normal. I'm going to get a little flashlight here. All right. I'm looking at the parts of your eyes, the white part, the iris, the sclera, the cornea. All of that looks symmetrical. I'm going to have you look straight ahead at me. I'm going to shine a little light in your eye. Pupils are both round, equal in size, and reactive to light. Very good. One more thing I'm going to have you do while we're on your face and before we move any further is, can you give me a big smile? All right, you have some nice teeth. And frown. Okay. And puff out your cheeks like a blowfish. Great. You can stop now. That tells me that your cranial nerve number 7 is intact and working well. Okay. The next thing we're going to look at are your ears. And just looking straight ahead. I'm looking side to side. The outside looks normal. Auricles are symmetric. I'm going to take a look on the inside. I don't see any drainage as of yet. Take a look at the inside. Have you had any ear pain or ringing? No? Okay, good. All right. I do see a little bit of cerumen, some earwax, which is normal. Tympanic membrane is gray. Looks flat. I do see your cone of light. At 7 o'clock. Come over to the other side. A little bit of cerumen again. That's your earwax. Tympanic membrane is gray. Looks flat. And cone of light at 5 o'clock.
Okay.
All of that is normal. Next thing we're going to do with your ears is do a little test for your hearing. Okay? The first test, I'm going to put this tuning fork on top of your head. And I'm going to ask you to tell me whether or not you can hear it the same in both ears. Okay. Yes. You can hear it the same in both ears? Okay. Very good. Now the next test we're going to do one ear at a time. I'm going to put the tuning fork on the bone behind your ear, the mastoid bone. And I want you to tell me when the sound stops.
Okay.
And after that, I'm going to put it off to the side and let you just hear it. And again, tell me when it stops. Okay? And I'm going to do a little timing while we do this. There we go.
I can't hear it.
About 12 seconds.
I can't hear it.
Okay, about 25 seconds. That's normal. The air conduction should be about twice as long as the bone conduction. Okay, now we're going to move over to the other side. Same thing.
I can't hear it.
Again, about 12 seconds.
I can't hear it.
Okay, again, about 25 seconds, so that's normal as well. All right, next, we're going to move down. I'm going to look at your mouth and your nose. Well, let's do your nose first. Alright, so I can see a little bit differently. Just going to look at your nose on the inside. Looks normal. No real drainage. Nose is symmetrical. Everything looks good there. Now I want to look at your mouth. Lips are symmetrical. No lesions or abnormalities. Open up. Stick your tongue out. Very good. And press down. Open up a little wider. And say ah. Hold on. Let's try a better light source. Stop. Tongue out. And ah. Very good. Okay. Uvula is midline, and the close larynx is normal. Tonsils are present at +1 station. Little bit of swelling back there. You have the sore throat a little bit?
Yes.
Yeah. Okay. All right. I'm gonna have you look on the inside. No real redness or exudate or lesions on your tonsils or anything. Little spot there. Looks like you might have bit your cheek.
I wear a retainer.
Okay. Does that rub against your jaw like that?
I probably wasn't paying attention and bit it.
Okay. Stick your tongue out again. I'm going to ask you to press against my... Alright, stick your tongue out again. Press against my stick. And I'm going to ask you to lift your tongue up. Just looking at the base. I see no lesions or abnormalities there. She can move her tongue, which tells me that there are no deficits there. When I ask you to say ah, and you're able to, and the uvula goes up a little bit, that shows me that your cranial nerve 9 and 10 are both intact. Alright. Now we're going to move down to your neck. Okay? First, just looking at your neck. Everything looks symmetrical. I don't see any gross abnormalities. Feel of your neck. And your pulses. Strong carotid pulse, no thrills. Strong carotid pulse here. On the left, no thrills. Okay. Now I'm going to take a listen at those arteries. And I don't hear any bruise, which is normal. Okay? The next thing I'm going to do is I'm going to palpate for any lymph nodes that are swollen. So I'm going to start at the base of your neck, the base of your skull, I'm sorry, on the back of your neck. And feel around. Tell me if anything feels sore or tender. Feel around to the post-auricle area behind your ears. And then the preauricle area. While I'm here, I'm going to have you open up your mouth wide as you can and close it. Okay. Jaw felt normal. No clicks. I didn't hear any or feel any clicks at all. You had any problems with your jaw? Okay. I'm just going to feel down your neck. I'm sorry, I'm going to go ahead and finish your jaw. Alright. And feel down your neck. Again, looking for any abnormal lymph nodes. And a little bit deeper in the supraclavicular area. One last thing I'd like to do for your neck before we move on, just look straight ahead, sit up straight. And feel your thyroid. And if you could just swallow for me. Good. That feels normal. I don't feel any lumps or nodules there either. Okay. Then for the next part of our exam, we're going to focus on your chest. If you could, can you take off your shirt for me?
Yes.
All right. And again, first thing we always do is look and watch you breathe for a few minutes, a few seconds. Chest rise and fall looks symmetrical. Both sides. All right. I'm going to start by feeling of your chest, palpating. Any tenderness anywhere?
No.
Any coughing, shortness of breath, wheezing?
No.
All right. Now I'm going to do a little test called Fremitus. I'm going to have you say a few things while I'm feeling of your chest.
Okay.
All right, so for the first part, I want you to say 99.
99.
Okay, again,
99.
again,
99.
again.
99.
Okay, now I'm going to move to the back side. Say 99.
99.
Again,
99.
again,
99.
again,
99.
again,
99.
again.
99.
Can't really feel anything, so before I listen, I am going to do just a little bit of what we call palpating, and that's going to involve me putting my fingers on you and tapping my fingers, and that will give me a sound. So I'm looking for any abnormal sounds. Okay, so I'm going to have you lay back actually, which I think will make this easier. You might have to bring the camera in a little bit, Aiden. All right. So it sounds a little bit duller here than here. Duller there, more resonant there. I don't know if you can hear it with the camera, probably not. Alright, before we move to your back, I'm going to go ahead and listen to this side. It'll probably be easier if I have you sit back up. Alright, take a deep breath and let it out. Now say 99.
99.
Okay, deep breath. 99.
99.
Deep breath. Deep breath. Deep breath. Very good. All right, now I'm going to move around to your back. Tapping, looking for that sound. All right. Deep breath. Deep breath. Again. 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 One more time. Again. And last one. All right, your breath sounds are very clear. to auscultate throughout all the lung fields. I don't hear anything like wheezes or crackles or rhonchi or anything of that nature. Okay? But I am going to have you do the Frembus test again. Can you say 99?
99.
Again?
99.
Again?
99.
Again?
99.
Again?
99. 99. 99. 99. 99. 99.
All right, all done there. And that seems normal. The sound is what's the word I'm looking for? Consistent throughout. Okay? Now, I'm going to go ahead and start listening to your heart. Have you had any chest pain at all?
No.
Ever felt like your heart is beating too fast or abnormally?
No.
Okay. So I'm going to move down the second intercostal space. Listening for the aortic. And the second intercostal space on this side. Listening to the pulmonic. Heart rate strong. I hear S1 and S2. And then move down to the, let's do this one. Move down to the third intercostal space and listen to Erb's point. Nice and strong again. Move over to this side, listening to the mitral valve. Between the fourth and fifth intercostal spaces. And back over to the tricuspid. Now this time, I'm going to time your pulse. Just breathe as normal as you can. Pulse is 80. I don't hear any murmurs or clicks or friction rubs. I'll listen one more time with the bell of my stethoscope. It's pretty normal. I can hear it much better this way. Very good. Okay. So the next thing we're going to do is I'm going to have you lie down and I'm going to assess your abdomen. Okay. So I'm just going to watch you. Again, I should probably be on the right side. That's the more preferred assessment size for the side for the abdomen, but our room doesn't really allow that. So we're going to go with it. So I do see some stria, which is just a sign of some stretching of your skin. It happens to most ladies at some point in their life, usually after babies, but it can happen with weight gain too. Okay? Or strenuous activity or, pulling of the tissue. Now the skin is warm and dry and pink. I see good turgor, no tenting. Okay? Now before I go poking around on your stomach, I'm going to listen to it. And I'm listening for your bowel sounds. Okay. Start on the right lower quadrant. I can hear it good this time. Good. Alright, bowel sounds are normal. Now I'm going to press around on your belly just a little bit, okay? And I want you to tell me if anything hurts at all or is tender. Anything up in here?
No.
Have you had normal bowel movements?
Yes.
Okay. Any change in the consistency or the color?
No.
No. Okay, now I'm going to feel just a little bit deeper. Again, tell me if anything hurts. I'm just feeling for any masses that don't belong there. And I think everything feels normal. I'm feeling your kidneys, which I can't really feel, I shouldn't really feel. And nothing on this side. Double check over here for your spleen. No. Okay, I'm going to do a little tapping on your stomach too. Sounds more hollow down here, you hear that? Sounds more solid up here, you hear that? That's your liver. Probably about 7 centimeters below the costal space. And while you're lying down, I'm going to go ahead and have you take a deep breath in. Great, and I can see my hands move symmetrically with her inspiration. Alright, you can zoom back just a little bit. Okay, I'm going to feel of your femoral pulses here, which is just your heartbeat in your groin. Nice and strong there. Nice and strong there. Okay. I'm going to have you sit up. There we go. I'm just going to do your arms and your legs, and then we'll be done.
Okay.
Okay, if you could, just raise your arms out in front of you, and turn your palms up to the ceiling. Very good. Bring your elbows up, right angle. Can you go any further and touch your shoulders? Excellent. Can you raise your shoulders up to your hands over your head? Okay. And straight up. Very good. And back down. Any pain at all when you do that? No. Okay. Now I'm just going to feel of your radial pulse in your left hand, left wrist. Nice and strong. +2. I'm going to check your capillary refill, which tells me your circulation is good, and that's brisk. Probably about 2 seconds, maybe even less. Pulse is strong. +2. Capillary refill is fast. Very good. So I'm going to ask you to scoot your bottom back a little bit. We're going to look at your legs. Straighten out. Can you bend your knee one at a time? And straighten it back out. And point your toes to like a ballerina. And pull your toes up towards your head. Any pain at all when you do that? No. All right, I'm just going to feel your pulse on this side. And then the posterior tibial. Nice and strong, no edema. Her legs are warm, her skin is warm, her legs are, her skin is dry, no edema present. I do see some discoloration spots, and she told me earlier these were from bug bites in the past, where she likes to scratch them. So I'm going to feel it.
And there's a few floor burns as well.
Floor burns?
Yes.
You want to explain that?
I play volleyball, and sometimes with sliding, my skin will get caught on the floor and
like
create burns.
Okay. Bend this knee up. Okay, straighten it out. Any pain at all in your hips?
No.
Okay. All right. Now, I'll have you scoot back out to the edge. I'm just going to check your reflexes. Let your feet dangle a little bit. Good. There we go. Reflexes look normal. So I think we have a fairly normal physical exam today.
Okay.
Thank you. Fair enough.